But I'm here to tell you about our National Hispanic Medical Association. And just to let you know, we're all in the same goal and the same career of medicine and being leaders. We were established in '94. The mission to empower Hispanic physicians to improve the health of Hispanics with all of our medical societies, resident students, and public and private partners. In 2002, we established our foundation to have a 501c3 to be able to get funding from foundations. And somewhere along the line, we started our HispanicHealth.info. It was actually 2004 for patients and professionals in English and Spanish. And if you look at that now, we have different disease categories, especially COVID-19, and a lot of information. I wanted to let you know that the Supreme Court is about to hear affirmative action this year. If you don't already know, Harvard and the University of North Carolina are going to be challenging the importance of supporting the importance of affirmative action. But because the Supreme Court has changed to become more conservative, we all are fearful that affirmative action is not going to be around very much longer. California, Michigan, and Florida have already banned the consideration of race in admissions in public universities. And actually in 2020, California voters decided to reject the proposal to repeal the state's affirmative action ban. So it doesn't look good. And whatever you can do, we are part of the AAMC amicus brief to support affirmative action. We have different programs, and I just lumped 2 slides and because I was only given a few minutes to talk, but our major programs are now health communications campaigns. We have a great communications team. The biggest one we have is Vaccinate for All, which was started with the support from CDC and Johnson & Johnson and Bio, and other companies have come on board. But the major focus has been to get doctors on TV, English and Spanish TV. And I know Elon Shapiro is right here, one of our doctors, who's been media trained. We are media training and placing with partners, Univision, Telemundo, ABC, NBC, MSNBC, CNN, and others. And in Nebraska, in Phoenix, in New York, in DC, and in Los Angeles, and actually in San Francisco too. And our biggest goal with vaccination is to increase the voices of Latino doctors and health professionals to be able to see, for our communities to see us. We have community vaccination grants to our chapters. We now have 18 chapters, and we've been training Hispanic health professionals. We have a group called the National Hispanic Health Leadership Professionals, the Hispanic dentists, the nurses, the social workers, the dietitians, the mental health groups, and we actually started 3 years ago, the National Hispanic Pharmacists Association. We also have monthly COVID webinars that started in April 2020, a health literacy toolkit and lectures, vaccine disinformation and uptake, and an All of Us research program with NIH that is very, very important for the next generation of researchers to have open access research and data, genetic information. And I know that Dr. Eliseo Perez-Table is very involved with NIH and empowering more of our young researchers to get involved. And we have our Let's Stop HIV Together and our cardiovascular and asthma advocacy projects. The other projects we have are education programs for individuals. And I invite you all to think about these programs as you go on in your career. Our NHMA Leadership Fellowship with CDC funding for 5 years is for physicians over 5 years of training. And it is a 1-year executive development program for Latino health and also cultural competence issues. We actually have developed it into a 3-month virtual program on Friday afternoons, and then a 1-week coming to Washington, DC. 20 doctors from around the country who want to be public health leaders and leaders in their settings wherever they work. We have an academic career development program with NIDDK and NIH that up to 35 young faculty and last year residents can come to our national conference paid by NIDDK. We don't get any money. It's the travel awards for young doctors to meet NIH. And then we have our Hispanic Leadership Development Fellowship. This was brand new, and thanks to Congresswoman Lucille Roybal Allard, we were given, but we were able to get appropriations language to support the Office of Minority Health to start a brand new program for minorities to work at HHS. It's the first time there's a health leadership program for 3 different awardees got it, the GW Public Health School, the Johns Hopkins Public Health School, and NHMA. And our program is Hispanic for 10 graduate students or students who have just graduated in 2 years to come and work for a whole year in June with mentoring and with lectures and to learn about working inside HHS, the U.S. Department of Health and Human Services. For medical students, we have always had our scholarship program. If you don't know about that, we have the program, from our foundation, the NHHF. We added a new scholarship program this year from Lubriderm, but it's for dermatology residents. And then we have our NHMA College Health Scholars Program, where we have medical student mentors for pre-med students. And you can find out more about this on our website. The NHMA Medical School Liaison Program is the other program that we started with LMSA in 2017 to find doctors in the community who could be role models for the students to learn about what it's like to be a doctor in the real world, besides your faculty and besides your residents that you meet in your hospitals. It's nice to start talking to doctors outside about how they got to where they got and what kind of settings they work in, clinics or hospitals or private practices, group practices. We're expanding that program, and hopefully this is a couple of things that we're going to be talking about at our conference, March the 24th through the 27th in Washington, D.C. Dr. Francisco Fernandez, who was a founding dean of the University of Texas, Rio Grande Valley, was very adamant that NHMA should be more closely affiliated with our medical schools. We're all alumni from the medical schools, but we're not faculty. Not all of us are faculty. And we would like to do is to have, we're having a special session on Sunday, March the 27th, to expand the collaboration with leadership, faculty, and GME, and to develop our own visiting lectures program with alumni and to help with recruitment, curriculum, and DEI projects. We've done this a long time. We've always have jobs announced in our newsletter. We always have faculty asking us for Hispanic residents and faculty. And we're going to start with the medical schools that are in our chapters. And then we have our councils and chapters. And just to let you know, we started councils of anesthesiology, dermatology, cardiology, clinical research, emergency medicine, family medicine, internal medicine, pediatrics, public health, and surgery. They're not all active, but they will all be introduced at our national conference. The goal is to bring them to our conference so that medical students and residents and doctors who come together can start meeting our specialists, and also to network and to find out how to get into those residency programs. We've asked them all to have virtual webinars starting this fall to help again with access to the residency programs and to helping you with career development. And then our chapters continue from across the country. We don't have as many chapters as LMSA, and what we want to do is work together in the chapters. And then my last slide here is just about our conference. We are opening up the conference with the CDC Director, and we're hoping Bob Valdez is, he's already told me he wanted to be there. We haven't confirmed, but Dr. Robert Valdez, if you don't know, has become the Director of the Agency for Healthcare Research and Quality. And we're very proud of him for taking a leadership role within the administration under the Secretary Javier Becerra, who I went to college with. So it's an exciting time for Latinos at HHS. And these are our contacts. NHMAMD.org is our main email, and our foundation is main website, NHMAfoundation.org is where you could find the scholarship information. Our scholarship applications will be available May 1st. And if I can answer any questions, I'll be here all day and tomorrow. And I thank you very much for your attention. Thank you.